Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back, dear viewers. Today I want to give you certain information about MHPSS, introduction to MHPSS. So before I start this video, I request from you guys to subscribe to my YouTube channel, like this video if you found it helpful, share the content with your friends and colleagues, and drop a comment in the comment section below. If you have ever wondered how people survive emotionally through wars, distress, or displacement, this video is for you. Today we are diving deep into an important but an often overlooked topic, that is mental health and psychosocial support, which around the world millions of people face stress, trauma, and uncertainty every day. But recovery is not just about food, shelter, and safety. It's also about healing the mind and rebuilding hope. Organizations like WHO, World Health Organizations, and UNICEF emphasizes that mental health is just as essential as physical survivals. Today in this video, we will break down what MHPSS really means, why is it important, how it helps individual communities recover, rebuild, or grow stronger even after experiencing toughest issues. Mental health and psychosocial support, MHPSS, refers to a broad range of services and activities designed to project forward or promote psychological well-being and prevent or treat mental health conditions such as anxiety, depression, schizophrenia, and psychosis, especially in situations of crisis, conflict, and displacements. MHPSS is a core concept within the humanitarian work and is widely used by organizations such as WHO, World Health Organizations, and UNICEF to support individuals and communities facing extreme stress. MHPSS, at its foundation, it recognizes mental health is deeply connected to social, cultural, and environmental factors. People affected by war, natural disasters, and poverty often experiences not only psychological distress, but also anxiety, depression, and trauma, but also disruptions in family structure, community networks, and daily routines. MHPSS both has addressed and addressing both dimensions, such as mental health aspects of clinical and psychological care, and psychosocial support like social support, relationships, and community resilience. One of its key principles, one of MHPSS key principles, is that support should be layered. Not everyone needs specialized mental health care, but everyone can benefit from the basic support and protection. This idea is often illustrated through MHPSS pyramid provided down there below, and we shall see them one by one. This idea is often illustrated through MHPSS pyramid, which is the basic services. The first layer is providing clients or people in need basic safety and security. Second layer, community and family support. And third layer, focus non-specialized support, that is psychosocial support. And lastly, specialized services, that is when we are providing medication to people with MHPSS conditions. MHPSS activities can take many forms, such as at community level. They may include safe spaces for children, peer support groups, and awareness campaigns to reduce stigma. At more focused level, trained workers or trained social workers might provide psychosocial, psychological first aid and basic counseling services. For individuals with severe conditions, specialized services such as therapy, which is also known as counseling, or psychiatric interventions are provided or may be necessary. Importantly, MHPSS is not only about responding to problems, but also about strengthening resilience in the community or in people we are providing humanitarian services, or in the people we are helping at their own levels. It aims to help individuals and communities cope with adversity, rebuild social connection, and regain a sense of normalcy and hope. Cultural sensitivity as well and local perceptions are essential, as affected support must align with the values and practice of the affected population on the ground. In today's world, marked by a conflict, displacement, and climate-related crisis, MHPSS has become an essential component of humanitarian responses. MHPSS bridges the gap between emergency relief and long-term recovery, ensuring that healing is not only physical but also emotional and social. As we have already seen, MHPSS is more than just a support, it's a lifeline. It really helps people cope with trauma, reconnect with their communities, and regain a sense of normal life. Whether through simple acts of support or specialized care, every support counts in restoring dignity and hope of the people we are serving. In a world facing increased conflicts, displacement, and crisis, understanding mental health and psychosocial support in MHPSS is no longer optional. It is essential. Thank you very much for watching this video. If you found this video helpful, don't forget to like, share, and subscribe for more content like this. And remember, please, supporting someone's mental well-being can start with something as small as listening. Wish you good. I request from you to subscribe to my YouTube channel, like this video if you found it helpful, share the content with friends and families, and drop us a comment in the comment section below. Until we meet next time, wish you success. Thank you very much for watching.